welcome to you from Geneva, Switzerland. A warm welcome to you from Geneva, Switzerland, wherever you are joining us, whether it is morning, afternoon, or evening. I very pleased, despite the challenges of this pandemic, that hundreds of potential participants from all over the world are joining together. We have received over 1,000 applications to the COVID-19 Scholar Peer Hub. And the purpose of this session is to come together with some of the founders of the Peer Hub. So these are the immunization professionals from over 50 countries, I believe, who in the preceding 2, 3, 4 months have been working together, meeting every week in order to put together the design and to figure out what we could do together, connecting across borders that might actually practically help each of us to do more than we could do if we were to go it alone. I'd like to welcome Alain Blaise Tatsinku, Charlotte Mbou, and François Gass, as well as the Scholar team leader, Doreen Imanyara. Welcome to you. Let's hear from Charlotte. Charlotte, how are you doing?
Thanks to everyone. Good afternoon, good morning, evening from wherever you're joining us from. It's a great pleasure to be here today and to have all the members of the pilot team that put together the COVID-19 Peer Hub, and really to say it's finally here. We finally made it. We did it together. And as we always say in the Scholar program, that we do it for you, with you, and we are going faster, further together. So everything has been put to place. As Reda said, the applications have gone out, and in just about 6 hours, over 1,000. And we are accepting applications up to the 13th. So if you're in the room and you have not yet applied, we just invite you to do so. And just also invite, after applying, just share on the various platforms. Don't be scared, or you don't have to be reticent that your place may be threatened. No, I'm so glad that here, the pilot team that's in the room, there are those that have already been that's officially accepted as part of the exercise. So I'm really just so excited about everything that is happening, and really looking forward to when we are going to launch and kickstart based on all that which over the weeks we have built together. Thank you very much, Reda.
Thank you, Charlotte. So in the room with us are 37 of the 60 or so Anglophone participants who have helped us build the Peer Hub. A larger group of Francophones has been meeting on a regular basis, building from an original group of 663 participants who had attended all 3 of the COVID-19 global events that we held in late April, early May. Today's a big day because we're finally sharing with everyone who was not closely involved in the construction of the Peer Hub, the call for applications. So you can see applications will be accepted until the 26th of July. So you have 13 days to apply. I'm going to show on screen there are people joining us on our Facebook page. So that's the Digital Scholar page. Hello to Abraham Aminanor. And also I had already showed Ahmad Navid Nusrat Shakar has been with us on many of these Facebook Live events. Some people are telling us that it's actually better quality and easier to access than Zoom. So we're striving to make these technologies, to find the best technology that fits the purpose and the needs that you have. Let's go to Dali Raphael Calette. So from Abidjan, Ivory Coast, who sends us a meeting in French. We just finished the meeting with over 135 Francophone founders. So yes, indeed, we are calling you the founders of the COVID-19 Scholar Peer Hub to recognize the work that you have done that has gotten us this far, helping us figure out what is actually going to be helpful to you, who are immunization professionals who have been, just like everyone else, hit by this pandemic, but for immunization services, potentially severe consequences over both short, medium, and long term. So we're going to turn to the 43 founders who are with us now, who are joining, who are trickling in. And we'll be asking you, founders, to explain and to present the COVID-19 Scholar Peer Hub to those of you who are on Facebook actually watching, whether you have applied already, over 1,000 people already have, or whether you are thinking about it. So Alain Blaise Tatsinku is an indefatigable scholar a key member of the Scholar team and in touch with so many of you. Alain Blaise, I'd like you to introduce as well. What are we doing with this Peer Hub? What is this about?
Thank you very much, Reda. So good afternoon, good evening, or good morning, depending where you are connecting from. So today is the day, like you said, and I would like to stop here to really turn to the co-founder. If you're in the room, you are not co-founder. It's not a problem. They did something impressive. We tested our own tools to make sure that they were really adapted to our needs. We professionals working on COVID-19, we really want a level of support. And I know that in the room here, Reda, you have many scholars. They've been there. They know the kind of environment we created, the environment that is supportive to your day-to-day work. So now we're here. We're happy. Why? Because we're going to start very soon. We start with the applications to get into that P hub that we created together. Don't feel frustrated if you were not among us, but you're welcome in that community. What is important here is to really share the application. Why? Because we share in the Scholar community. We know what our strength is, share and learn all together, creating a safe environment where each professional is valued. And that is very important that you share if you receive the application again, we did it on purpose because we really want to share it. You are already familiar with tools, but now we want to see how the tools are going to help each of us in the P Hub in our day-to-day work. So today is special. So welcome all of you. Those who have applied already, those who have not, please go ahead. But please don't forget that we want you to share that to all the professionals engaged in that COVID-19 because it's only together with our strength and you will discover the engine. I won't talk about that. I will start with just saying that you have the application, please go ahead and share it as much as you can. And don't think that you won't be part of the P Hub because you shared, we have place for everyone. So don't stop sharing that. So I will turn to you back, Reda.
Thanks.
And so that you will talk about the component. So
right.
Welcome to everyone.
Thanks, Alain. And I'm going to turn to the founders of the Peer Hub so they can tell prospective candidates and people who are considering applying or have already applied but just want to know more, whatever the case may be. So Ian Steed, together with the rest of the team, has ran a small-scale pilot that involved 300 scholars. I say small scale because, as you can see, it's been 6 hours and we already have over 1,000 participants. Gloria Archibong has raised her hands. And Gloria, I want to welcome you and we would love to hear from you. Gloria, are you able to unmute your microphone, or was that an accident? And for those of you whose screen is blurred in Zoom, Zoom has deliberately cut the bandwidth on a lot of the webinars and a lot of their tools. So this is one of the reasons why we're also streaming this on Facebook. So please you can go to the Digital Scholar, so the Geneva Learning Foundation's page, and connect there. I see many of you already have. All right, so there are some amazing things that we're hoping to offer when you join the Peer Hub. And all of these tools, the Ideas Engine, the Peer Hub exercises, the Impact Accelerator, are either things that we have done before working with hundreds or thousands of immunization professionals from all over the world, or in the case of the Ideas Engine, it is something new. So there's always a kind of pause when we call on participants. So no, Rajat, it's not on YouTube yet. Let me know if it would be useful for you to be able to watch this streaming on YouTube as well. My sense is that for most people, YouTube is not practical enough, unlike Facebook. But we could also stream this on Facebook, indeed. So if you'd like to tell us with the Ideas Engine, Atahir Abubakar actually submitted 7 ideas and experiences. So Atahir, I am going to turn to you. I know you just came out of another scholar session. Are you able to unmute your microphone and tell us to explain to prospective candidates what is the Ideas Engine and what was your experience of it? What did you get out of it with respect to the critical work that you are doing COVID-19? Yes, Atahir, please remind us where you are connecting from, and then please tell us what is the Ideas Engine.
Computer Nigeria for now. I didn't hear well.
Yes, we can
Hello?
hear you. It sounds like you're fiddling with your microphone or with your headset.
Yeah.
Yeah, go ahead.
Um. Yeah, I can hear you now. I didn't get you early. Sorry, I missed your questions.
Okay, so I'm asking, what is the ideas engine? Can you
Hello?
explain it for people who are going to apply or have applied for the Peer Hub?
Yeah, I have some ideas that I will share in the engine room. One of the ideas is using men as partner in mobilizing for immunization during COVID-19. The other ideas is using community structure to mobilize for immunization during COVID-19, where we train some community caregivers that go house to house to sensitize caregivers on the importance of coming out to vaccinate their children during COVID-19. Just of recent, as of yesterday, we saw a publication that is giving a green light that children that were immunized with BCG tend to have a little resistance on COVID-19. So we print that aspect and use it as some of our entry point in some of our communities so that we can increase mobilization.
Okay.
Hello, Reda?
Yes, thank you, Atahir. Okay, on this question of BCG, we're not going to get into that right now. If there's a member of the International Advisory Board who'd like to comment on that, you'd be welcome to. I want to warmly welcome Alan Brooks, Shizoba Winodi, Felicity Katz, François Gass, Joseph Bier, who basically, just like everyone else, the pandemic came in the middle of what we were doing, which was the Teach to Reach program. And members of the International Advisory Board for Teach to Reach, they have accompanied us on this journey to figuring out how we can pivot our activities to actually serve the needs of immunization professionals who are trying to figure out how to face the pandemic, prepare recovery, and actually restart services in some cases. Let's go to Fatima Hosseini. So, Fatima Hosseini, how are you doing? Remind us where you're connecting from, and then tell us. Can you explain to us what was the ideas engine for you? If you, I believe you did not necessarily submit an idea, but what have you? Tell us what you're doing right now, how you're being affected by the pandemic, and tell us why you are participating in the Peer Hub.
Hello?
Yes, we hear you loud and clear. Fatima, are you able to speak to us? It sounds like there's either a long delay or that you have a connection issue. So I think if there are others. So
Hello?
Yes, Fatima, go ahead.
Can you hear me? Okay, can you hear me now?
Yes, could I ask you to speak much louder?
Okay. Good afternoon, all. Hello, good afternoon, all.
Yes, we hear you. Please, please go ahead.
Okay. Good afternoon, all. I'm Fatima Hosseini from Katsina State. I want to talk about the issue of my brother, what has just said on that they have started sensitization in the community and everything. We all know that issue of immunization is becoming a devastating issue, especially in the northern part of Nigeria, because people are not accepting the vaccination due to so many issues. I know that VCM network is the best way to tackle this issue of immunization because they normally go to house for sensitization and taking of data. But unfortunately, due to what is going on in our country, issue of selection, they are not doing the selection based on merit, because I can say 90% of the VCM network are not from the LGE, they are not from the community. So the way things are going, I don't think if truly the sensitization will make an impact. I'm sorry to say, because during this selection, you may find out that somebody that cannot even speak Hausa with different ethnic, different language, different religion will be fostered to an area whereby they are Muslims, and then at times they are Hausas also. So this also brings another issue of immunization. Hello?
Yes,
Hello?
we hear you loud and clear, Fatima. Thank you for this contribution. There are many issues which you will be able to engage with people not only from your own country but also from other countries by participating in the activities of the peer hub. The bottom line is that this is not a course. We know that you are short on time, and so this is about giving and receiving support to each other as immunization professionals so that we can do better, figure out what works, adapt it to our own context, make sense of it, and make progress against what your Ministry of Health or your employer are asking you to do in the face of the pandemic, in line with the Ministry of Health plans and the WHO recommendations. All right, let me bring up the questions on screen, which I'd like to turn to the founders of the Peer Hub. So scholars who participated over the last 10, 12, I think this is week 10 or 11. We've met every Monday. We've done follow-up work to better understand what the needs are. And so these are the three questions that I'd like to ask you. And again, asking for volunteers to focus on responding to these questions. Why have you joined the Peer Hub? What do you expect to gain from it? And what is your Ministry of Health or employer asking you to do in the face of COVID? What's the biggest challenge that you face to achieve this? So I can see that some of the founders are thinking about and composing their thoughts. So I thought one of the things we might try to do is to make it add a little bit of music as you're thinking about it and before you raise your hand. Okay, but this happened with the Francophones too. Group is really quick. So let's go to Lizzie Igbine or Igmine. You'll tell us, Lizzie. I know it's not the first time I've mispronounced your name. Lizzie, go ahead and unmute yourself, please. If you are able to. Yes.
Hello, everyone. Good day.
Hello and welcome.
My name is Lizzie from Nigeria. Why I joined this group is I thought I needed to learn more. And this group has helped me, expose me to more of what is expected of me as a community worker in immunization. So I'm very glad of what we have learned over the weeks. I'm very happy. And I say that I will continue so that I will be an expert in my field. Thank you.
Thank you, Lizzie. And can you tell us what your Ministry of Health or your employer is asking you to do? Can you tell us first what you do exactly?
Okay, what we do is to support the ministries in communities by ensuring that the community people come out and participate. Right now, it is difficult because they say everybody should stay at home, and people are not getting their expectation from the government. So they are resisting. We are not seeing them. We have to go and knock on their doors. And some of the time when they are ready, the ministry is not there because they don't have their full staff in the field. So the issues and the problem is from both sides, from the people that should give the service and from the people that we are expected to serve. They are not coming up as they should. Thank you.
Thank you, Lizzie. So we hope through your continued participation in the Peer Hub that you will be able to connect with others from other countries as you try to get the job done, as you try to work and make progress, benefit from these connections with others and from the ideas engine. Let's go to Rajat Garg now. Rajat, over to you.
Hello, thanks, Reda. Why I have joined Peer Hub? Actually, I want to contribute to the global immunization in whatever possible way. That's why I have joined Peer Hub. What I am expected to gain from the Peer Hub? I want to have cross learnings from thousands of or all the participants of the Peer Hub. They will be sharing their problems. They will be sharing of solutions. They will be sharing of ideas. So definitely, it will help me in doing my job and addressing the immunization concerns in my country in a better way. Now, the third question: what is has my employer asked me in the face of COVID and the biggest challenge that I faced to achieve this? So, as I work in India and I am working on a digital training tool, like we have got an app we are giving the training to the health workers through an app. So as the app, we have to give the training. Suddenly the COVID pandemic started, and now we have to, we cannot visit the field, we cannot do the hand holding, and we have to give the training through distance only, like use of WhatsApp, use of phone calls. By that only we can give the training, and we can ensure that the health workers take the training. So what we did was we created different WhatsApp groups. We kept on posting the messages. We actually do one-to-one hands-on through phone calls, whatever problems people were having. And in this way, we ensured that even in the last 4 months of COVID, also most of the people are able to take the training, and almost 80% people have completed the training. We've already also pushed the COVID-related material through the app. Thank you.
Great. Thank you so much, Rajat Garg. All right. So we have many more raised hands. One person has a device name home, so we don't know who you are, but let's go to Sohini. Sohini, how are you doing? And why have you joined the Peer Hub? Remember to tell us again a little bit about who you are and what you do.
Hi, Reda. Hi, everyone. My name is Sohini, and I choose to speak right now because Dr. Rajat and I are working on the same project. So we both, have a similar project that we are looking at, which is capacity building for health workers using digital methods of learning. So the reason I joined Peer Hub is because, I feel that whatever ideas that anyone anywhere in the globe is trying to implement right now, or any best practices that they want to pick up and replicate, it would involve capacity building in some way or the other. Someone will have to be given some bit of a hand holding, some bit of support, some way of transferring the knowledge, so to speak. So since I have worked extensively in capacity building, I really hope to be able to contribute to anybody actually who would need any kind of support in this particular domain. What I expect to gain from Peer Hub is that, I'm very new to public health, so everything is a learning for me. So I'm very excited to, look at ideas, look at best practices, and I feel that everything is going to be a learning, whether the idea is something that can impact immunization in India, or even if it is not, everything is a new world for me. So that's what I hope to get. I hope to network with people. I hope to connect with people. In terms of the third question, yes, again, it's a little bit similar to what Dr. Rajat said, but what I would like to add is, one of the donors here in India who we all really respect and look up to, he said that do your bit. That's all he said. So, we don't know when we might be asked to do something for the Ministry of Health. We don't know what our employer is going to ask us to do in terms of a response to COVID. But yes, I am excited and I am charged up to do my bit in terms of what is asked of me by the Ministry of Health and what is asked for me in terms of the Peer Hub as well. So all the very best to everyone, and over to you, Rida.
Great, thank you. And again, for those of you who are just joining us on Facebook, today is the first day we are publicly announcing and sharing the call for applications to the COVID-19 Peer Hub. So the Peer Hub purpose is to share experience, spread ideas, and take action to keep vaccination going, or restart, or reboot during the pandemic. We launched a call for applications today at 7 a.m. Geneva, and we have over 1,200 applicants as of right now. So if you're joining us and you have questions, please type them in the comments in Facebook. We're keeping an eye on the comments. If you'd like to know more, you can click here to apply. Now, let me warn you, though, that there is quite a detailed and comprehensive application. You have been invited to submit, but we ask that you take your time to provide quality answers to all the questions. Why? At least two reasons. One is that if you don't, your application may be dismissed, and that would be unfortunate. And we know you're short on time, but we ask you to make a little bit of an extra effort there. The second reason is that this application is also a data collection tool. So by spending time on the application, you'll be helping us build a picture of what is happening with immunization professionals across all levels of the system, across at least 50 countries, in ways that we would not be able to know by any other means, because you are the ones who are there, closer to you, for some of you, very close, if not in direct contact with the children and families, or involved at various levels of the system. And so we need that contribution to be able to make it through the application. So I suggest you do this from a desktop machine. Don't try to do this from your phone. There are some open-ended questions that are highlighted as being especially important. Starts by asking your name and your email, but it gets a lot more involved than that. So please do take that into consideration when you are considering applying for the Peer Hub. So a lot of information you will find on this page. So I don't think we've actually shared that in Facebook, so I'm going to do that now. So yes, Peer Hub application here. I've just put that for those of you who have not seen the full page yet. And let's go now to Dr. Satabdi. Dr. Satabdi, thank you for joining us. Please don't forget to tell us who you are, where you work, if you feel comfortable doing so. And what would be your responses to the questions shown here?
Hello, good evening, good morning, and good afternoon to everybody. Actually, I'd like to tell in short, because we are running in short of time. That is, I've joined in the Peer Hub because to have the experiences and the challenges and the problems that those are being faced by everybody nowadays who are working in the field of immunization. And I myself also in my state, condition is horrible. The unlocking phase was started near about 7 days back, and in context of the increasing cases, standing today, the number of the affected people is 30,000, and active cases are now 10,500. In last 24 hours, standing now, the cases have been 1560, among which 26 died. Though there are the people are getting cured, but the picture is actually horrible here. Once more, the locking process have been started, and the containment zone have been created further. And in this context, the immunization is suffering great, because we are getting the people having the children who have missed a number of the doses of vaccine, even the children who have not received the birth doses also. So I like to have the information, have the sharing of the knowledges and experiences from the field level active workers, that what they are doing, so that also I can present those things, that the hurdles we are going faced, the hurdles also being faced by the other people, and we can manage or handle accordingly. And for the state health and family welfare, we do by our allotment in some districts, and making these districts as the model, so that we can attend the challenges. And for the field level workers, especially, the challenges are to reach the community, as everybody is telling, that to reach the community without any proper protective equipments, because there is a shortage of protective equipments everywhere, even in the COVID hospitals also. The PPEs are not being disposed at all. BPEs are not being, they are being recycled. They are being used regularly, because there is no other thing in hand. And so it's they are a great challenge for us. And we are also, apart from this hub meeting, we are also meeting on every Saturday in our state health and family welfare department, how to do, what to do, and how to face these things, and to overcome these challenges. And that is all from me.
Great, thank you, Dr. Satabdi. Now, we know that you, Dr. Satabdi, and all of the other scholars that we have heard so far, you have dedicated time week after week to helping develop the Peer Hub, but we know that you are short on time, even more so, of course, during this pandemic. So For those of you who have not made the decision whether or not to apply or who are wondering exactly how it's going to work, here is a promise or commitment that we will make, is that this is about giving and receiving support. This is not about wasting your time. We will make every effort, and you will tell us if we go off course, if we are asking you to do things that are not immediately useful to you. We will stop doing those things and focus on what is actually going to help you with respect to what you are being asked to deliver. Now, one of the challenges we faced with the 3 global events attended by over nearly 7,000 participants was that in a session like this, right now we have only the founders in the room, but we know we will have much larger sessions with hundreds of participants in the room. And yet in 60 minutes, which is already a lot of time when you're busy in a hurry and you're being asked to do a lot by your Ministry of Health or your employer, we can at best hear 5 or 6 testimonies, 5 or 6 people who share their experience. And then in many cases, it might not be complete. It may leave you asking with more questions unanswered than you have answers to. And so this is how we came to think about the ideas engine. We said, what if we could find a way where everyone who has an idea or an experience in the pandemic, even a little idea, doesn't have to be a big game-changing idea, but anyone with an idea or an experience, something that they have actually carried out that has helped them to make a difference, to maintain immunization services, to prepare recovery, to prepare restarting a campaign. What if everyone was able to contribute those ideas and experiences, to share them in a way where you could instantly see all of the ideas and experiences being shared? So Ian Steed and the rest of the Scholar team piloted this ideas engine, and you can see here some of the results of the pilot on your screen. You should be able, so there's still some tests. This is a pilot, but you can see the titles for the ideas, and then each idea is detailed or described when you click here. For example, Mohammed Imran Qureshi proposed to establish a help desk at district level to address community concerns for vaccination in COVID context. So when you are accepted into the peer hub, step 1 is to apply, but once you are accepted, then you will be able to access the ideas engine. And actually part of the application, this long application that I encourage you to take the time to do properly, includes making your first submission to the ideas engine. So we ask you some simple questions, but as you can see here, Imran took quite a while to, took his time and gave a sufficient level of detail to properly describe the idea, so that it would be useful to a colleague who could be, as he is, from Pakistan or from a completely different country, who would say, well, yes, I like this help desk idea. And then you can do 2 things. The first one is that you can actually read up on the idea, make sense of it, figure out if and how it could be adapted to your context. And second, through the peer hub, you can also reach out to the author of the idea and connect with him or her and learn directly from their experience to go beyond what can be put into a form. So that's the idea of the ideas engine, and that is part of the package that you will get as part of when you join the COVID-19 peer hub. So we have some people, let me see, we heard from Atta here. Let me see if Adolphus, for example, or others who were sort of heavy contributors. I think I saw Loretta. Yes. Loretta, I'd like to turn to you. I hope the connection is working well for you today, because I'd like to ask you, you submitted an idea to the ideas engine. Can you tell us how it went for you? If you are able to speak to us. Yes, Loretta, welcome. Loretta, are you able to hear us? I think in some cases Zoom has this delay of a few seconds. All right, Loretta, it looks like at least I'm not able to hear you. All right, so you contributed an idea, but unfortunately, this is just the way it works. We're used to this. Everyone, myself included, everyone in the foundation's team for the Peer Hub is going to at some point get disconnected. Something is going to go wrong despite our best efforts. And actually, we have here Taimur Kayani, who congratulates the effort of Dr. Mohammed Imran Qureshi, whose idea I was just referring to. Malia Mungu Arnold, who says, looking forward to interacting with experienced colleagues to tackle health issues related to COVID situation and interruptions. Now, there's a clear focus of the Peer Hub specifically on immunization services. But of course, health workers who are interested in learning about that and contributing to that in some way, will certainly look at your application. So we're not dismissing anyone who can contribute to the COVID-19 response and help immunization services in any way. All right, it looks like we're not going to be able to hear from Loretta. Let me see who else. All right, Halima Toro. Halima, are you able to unmute? I hope your microphone and connectivity will be with us. And the idea is to hear from you what you participated in the pilot. Be really interesting to hear directly from you as we were able to do with the francophones. Let me just keep looking for, and if you'd like to contribute, please do raise your hand so I can immediately. Yes, Ahmad? Ahmad Navid Nusrat,
Yes.
Are you able to speak to us?
Yes, I am here. Can you listen me?
Yes, loud and clear. You're a little faint if you could speak up. But yeah, would you like to tackle the three questions? But before you do, tell us about, it looks like you did not, no, you did contribute to the Ideas Engine. So first tell us about that experience, and then if you'd like to tell us more generally about what you expect from the Peer Hub.
I am Ahmed Naveed Nusrat and I am speaking from Pakistan, Punjab. Nowadays, I am working as the master trainer for National Immunization Days and EPI. For answering your first question, why I have joined the Peer Hub, actually, I think this is the need of the time to establish such an engine where we can learn from each other. And whether I have viewed different types of ideas, I have come to know that we have round about a similar challenges which we are facing either any region of the country. So this is the reason that I have joined. My expectations are very high from all of my peers and from a very good expectation from all of you that either I am facing such a challenge which I could not able to solve this. So can I discuss with my peers and want to know that what is the better or what is the best solution to get rid out from this challenge. So expectation are overall good. My MOH is demanding from me that we cannot compromise on the coverage of EPI, as we have already my country is suffering from the polio disease, and we are one of the two countries from all of the world who has the polio virus in our the world. So my MOH we do not compromise on the we do not compromise that we do not get rid, we do not on the low target or low coverage of EPI. The biggest challenge regarding in this scenario which I am facing is that the people are shying, people are not willing to go, to left their homes and go to the kit stations, rather fix or outreach, and they are not. They wish that the vaccinators come to their homes and vaccinate them, but it is not possible. It is not against the protocols EPI program that we vaccinate each child from home to home. So this is the challenge for me, biggest challenge that motivate them. I through an announcement, and I wish that people come to the outreach kit station and vaccinate the child, and we do not miss any child for any type of intelligence. This is all from me. Thank you so much.
Great. Thank you so much, Ahmad Navid Nusrat. Now, as we said, we have heard, and we will hear, unfortunately, in this hour, only from a few people from a few countries. But let me tell you, with over 1,200 applicants, there will be people from your country, other than yourself, and there will be, potentially, and certainly many people from all over the world in very different systems the immunization systems that may be different from one country to the next, but all being confronted by the same pandemic and by similar consequences in some cases. Let me go now to Mohamed Orenin Otaru. Mohamed, are you able to unmute yourself? Yes.
Right. Yes, I have done that.
All right.
Okay.
The floor is yours.
Okay, hello everyone. In regard to the idea engine, before popping into the question displayed, I contributed in regard demand creation and reconciliation of immunization data. In demand creation, we sort of created from at the district level. We have established it at health facility level and community at large. So we made it a way such that comparing the data of the last 3 months of the pandemic lockdown, that was March, April, and May. So we realized that we had quite a number of dropout comparing Penta 1 and Penta 3 coverages. So the high dropout now prompted us to kind of establish a mobile outreach, so to speak, whereby we sought out using the tickler bag and the routine immunization register. We sought out the immunization cards of children who are already due for the antigen, 1 or 2 or even more. So we go out alongside with volunteer community mobilizer, that the VCMs here in Nigeria, we call them such. So we move to the respective houses in the community and get the children vaccinated. As such, we realize that that same month, the dropout rate across the health facilities to which such were conducted actually was appreciable. In fact, we had less than 10% dropout rates across board. So demand creation, of course, we think is the key. That's communication and engaging the community at large. Then looking at reconciliation, community leaders to which were engaged to collect data of children within their respective communities. Also, were engaged. We mapped out the community to which there are children that have not taken their respective antigen, and of course, we mobilize the RI providers at health facilities covering such district to get the children vaccinated. So scaling through the questions on the board, why you joined the peer hub? Yeah, I think the peer hub is an avenue for one to improve upon what he or she knows before, and of course address other parts that he or she thinks he knows or she knows that could be improved upon. So in a nutshell, peer hub, I joined peer hub because I think and feel is an avenue for me to improve upon what I have already know, because there are quite a number of professionals that can help me improve. Then what do you expect to gain from the peer hub? Yet, I expected that in the long run, I'm going to contribute my part to the global immunization activities, and of course improve upon my district, the rate at which dropout can be managed, and of course to improve the respective coverage within the community among children. Then what is your Ministry of Health or employ? Yes, they always tell you stay safe, keep safe, do your best, as someone else have rightly pointed out. Yeah, so in this case, we usually we sensitize caregiver. Don't worry, keep coming to the facility, you are safe. And of course, IPC measures were established. So the institutionalization of the IPC measure, that's the infection prevention and control measures being in place. Now, we realize that the number of health facilities so far, health facility staff so far are not putting all of those measures in place, like the hand washing facility at the point of entry of the health facility, all of the health workers, including the cleaners, putting or wearing their face mask, and even caregivers visiting for immunization activities or coming to access any other health intervention in the facility wearing their face mask and washing their hands before entering the facility. Honestly, we are still finding it a bit difficult to address such, but as of today, a number of health facilities to which I visited have shown great improvement in that regard. Thank you very much.
Thank you, Mohammed, for this contribution. Now, there is going to be a tremendous amount of diversity, people with different perspectives, with different experiences, with different levels of expertise. In order to be considered for the peer hub, we're going to ask you for that tolerance, for that understanding that people may have views different from your own, up to a point. And we have clearly defined a set of commitments that each of you, when you take the application, don't just click I accept, but take the time to read each of these. There's first of all a commitment to confidentiality, as you see here. So in practice, this means what the British called Chatham House rules, which means you will not name individuals, organizations, or countries when you share information from the peer hub, unless you have the person's explicit permission to do so. Of course, in an event like this, we're very clear that this is being shared, with whom this is being shared and how. Of course, if your employer or your government has specific restrictions and requirements on what you're able to share or not, we fully expect you, and in fact, in the application, we ask you to sign a sworn statement that you will respect and abide by any such restrictions. And then here you can see there are 3 commitments beyond confidentiality. A pledge to impact, which is what all scholars who complete a course are invited to take, to work with others to transform projects into action and results. Second, a commitment to progress in the fight against COVID-19. And if you find yourself in disagreement with any of these sentences, then please do not apply for the peer hub. These are the principles on which we will be operating. So if you have questions whether vaccines save lives or not, the COVID-19 peer hub is not going to be for you. You will see, so take the time to read through each of these commitments, including the 3rd set, which is about your COVID-19, your commitment during the pandemic itself. So these are available on the application page itself, on the announcement page itself. So don't just skip, and some of you will simply click here to apply now because you're short on time, and we understand that. But as you go through the application, do take the time to look at these commitments and consider what they mean for you. All right, we have 13 minutes left. I see the scholar team leader from Pakistan, Mohammed Imran Qureshi, has had his hand raised for a while. Mohammed, please, the floor is yours.
Thank you very much, Reda. Good afternoon, good evening, and good morning, the scholars from the world. And questions are pretty straightforward to me, honestly speaking. I have joined the peer hub, and the expectations from the peer hub are quite clear that whatsoever the challenges I'm facing, my country is facing, so peer hub, inshallah, would provide us the concrete solutions for all of those challenges and problems to deal and to tackle with the immunization challenges which we are facing, especially due to COVID-19 pandemic. And we will get insight from the world scholars, whosoever will be present on this peer hub. So we will be using lessons learned from there, and we will be utilizing their ideas and their practices, which they have already applied in their context and gained so much results. So we will be trying to copy and paste and lessons learned, but obviously contextualizing things in our own context. So from the Ministry of Health, what the expectations generally we feel is basically they are seeking technical expertise and guidance. So basically they just ask us if we are caught in such a position, in such a condition where there are COVID-19 pandemic challenges around us. So how you will guide us about the technical issues so that we could tackle around those issues, and they could take a concrete and solid decision. And this strategic decision making would be easier for them if we provide them some sort of technical guidance and skills and experience, so that to come up with a concrete solutions to address their technical problems. And obviously not just technical, at times the managerial problems are also. So dealing with all those problems would definitely resolve the situation. And coming back to the last aspect, which is the biggest challenge we are facing these days, the biggest challenge, honestly speaking, we are facing are two: dropping of immunization coverage and serious drop, honestly speaking. And the second biggest problem we are facing is the suboptimal performance of our VPD surveillance system. So at the same time, although the coverage is not to a desired level, but we expect to have more and more number of cases for measles, for diphtheria, for pertussis, for other vaccine preventable diseases. But unfortunately, the surveillance system is not picking up all those cases. The main reason, people are probably diverted, and they are doing more towards the COVID sampling, contact tracing, and so many other aspects to tackle the challenge of COVID. So they are probably over engaged in COVID, so they don't find time to focus VPD surveillance. That's why they are not only missing cases, but probably they are missing outbreaks. So we could guide whatever the lessons we would have learned from Peer Hub. So that will be applied in our own context at the provincial level, at the district level, and even at the health facility and community level, so that we could just guide them to tackle all these challenges. And challenges are mainly three. I just want to just summarize. First challenge is the provision of number of required doses of vaccine and logistics, because vaccine production and transportation is a real challenge. The second problem is the health facilities and the outreach sessions, which are providing fixed and outreach sessions, and their health workers, they are not providing up to a desired level services because of some sort of fear or some sort of other commitments. And then last comes the most important, which is the community aspect, because the community has certain lack of information or some concerns to address during this pandemic. So that's it from my side. Thank you very much.
Thank you. Thank you very much indeed, Imran. All right, I see. Are there additional hands raised? So you'll be able to go much further in the discussion, in the exchange, including on points where everyone may not fully agree within a specific country. But today is not the occasion for that. Today we are presenting and launching the call for applications of the Peer Hub. As you can see, as of today, the 13th of July, there are 13 days left for people to apply to join if you are an immunization professional and the immunization services you provide have been impacted by the pandemic. This is a network, the purpose of which is to help you to strengthen the work that you're doing to recover, to resume, to relaunch services, to improve, to catch up, whatever it is you need to do, connected with others from your country as well as from many other countries. So I'd like to now turn to the panel, and specifically members of the Teach to Reach International Advisory Board who have accompanied us as we, over the course of many weeks, thought through and went back to them and presented what we had in mind and reported back on what scholars were telling us was needed and what would be most helpful. So I'm eager to hear, now that we're finally launching the Peer Hub, from Chizoba Wonodi, from Felicity Cutts, François Gass, who's gone above and beyond his advisory participation, as well as Alan Brooks. Shall we start with Chizoba Wonodi? And Chizoba, I hope that you are able to speak to us. I'm grateful that you were able to join us today, and hope that this won't take you by surprise. All right. It looks like Chizoba is not able to speak to us. I've sent a request to unmute, but that's... let's turn to Felicity Cutts, and let's go to...
Yeah, hi Reza, thanks, and hello everybody around the world. So I think this is really exciting, and I congratulate the the team and all the scholar participants for coming up with this, because it's such an unusual situation that we're in. And so we definitely need innovation and exciting new ideas to be able to respond. I think the last couple of interventions have clearly laid out some of the really big challenges there are in maintaining vaccination services. But I love the ideas that are starting to come through already. The district hotline for answering questions from the community, I think is a great idea. So I'm really looking forward to seeing how people can manage to continue their work, and how this quite remarkable technology that we have now can allow people around the world to share ideas and enthusiasm instantly. So once again, I'm extremely impressed by all the enthusiasm and dedication that people in the field continue to show, despite all these really difficult challenges that you're facing. Thanks.
Thank you, Felicity Cutts. Let's go to, all right, it looks like Chizo was not going to be able to speak. Let's go then to François Gass, and then we'll hear from Alan Brooks. So both François and Alan have gone above and beyond their formal role in the Teach to Reach International Advisory Board, and have been advising us on much more, including the specifics of the ideas engine for François Gass, helping us figure out how to go beyond ideas into actually acting on the ideas. And Alan Brooks has used his vast experience and expertise to guide us in how we connect with other organizations, other partners. François?
Yes, hello everyone. Whatever time it is all around, I think it's an exciting start. And I must say, I enjoy the discussion that came through. And as Felicity mentioned, the critical challenge that everybody faced with a different weight. I think the weight can be different from one country to another, from a district to another. But I particularly appreciate the fact that there's now, I think, a better balance between the delivery of services by health staff, the demand from the community, the problem at community level, who have some fears and are not reassured if they can go free, with conflicting messages coming from wherever. And of course, the logistics support to make sure that all vaccine, this was very well to have the vaccine available timely. And I think those three challenges work together to restore immunization, and need to be properly assessed and going into the root cause analysis. And of course, what the Spear Hub will say is share ideas to make it, to resolve those problems. And I think there's never been such a need for ideas and innovation, as mentioned, to get through it. And I'm looking really forward to see those shared experience. And I'm glad to have heard that the discussion can continue between someone with a great idea that went into detail, but of course, you always know more detail on the implementation. And what's important is the implementation of an idea, and not just an idea on the shelves. And that's the biggest challenge, to make it to work. And I think a dialogue between people with an idea that sounds a great idea in another country, continuing the dialogue after the idea engine may be a very useful step towards making the idea work in another country. So I'm looking forward to see the exchange in this peer hub of all people who face this challenge. Thank you very much, and good luck.
Thank you very much, François Gass. Let's have a final comment, closing comment from Alan Brooks, who has been tremendously helpful both within the International Advisory Board and beyond. Alan, what are your thoughts as we're actually launching the call for applications today? And then I have one final comment I'd like to read to share with the group.
Sure, absolutely. So, Reda, I just actually want to give a thank you to those that have come to the table both during the development of this and that are clearly so interested in being part of taking this forward, because that commitment to that decision to come forward is saying that you're not only interested in doing your own work better, you're actually interested in improving the work of your peers, whether those be down the street, in the neighboring district, in the neighboring town, or even in a neighboring town or neighboring district in another country. And that is an amazing commitment to make. And so I just really want to say thank you for stepping up and showing that and living that commitment to your peers and to your colleagues. Thanks, Rada.
Thank you, Alan Brooks. So let's close. We're actually out of time. And as you can see, you have, as we're recording this, 13 days to submit your application if you have not done so already. We will be looking at these applications on a rolling basis, so don't delay. Submit your application as early as you can. Take the time to make it thorough. We already have over 1,200 applications, so we'll be sending out the first letters of acceptance, as well as the letters indicating what other opportunities might be available from the Geneva Learning Foundation. To close this meeting, I just spotted this message from Fatima Hosseini, who says, "I joined the group to speak on behalf of less privileged and to tell the facts of what is going on in my country." We'll close here. It is 6 o'clock, 1800 hours, 6 p.m. in Geneva, Switzerland. Thank you for having joined us, and we look forward to receiving your application if you have not yet sent it. And most of all, we look forward to thinking and taking action together thoughtfully, in measured ways, but in ways that are the ones that we identify as most likely to be effective together, learning from each other as we go. Thank you very much, and look forward to seeing you very soon.